My name is Amritha Jaishankar. I've been in the cell and gene therapy industry for 20 years in various roles in academia, nonprofit, federal, state, industry, spanning R&D, investments, grants, and now products and services here at Iqvia. So really excited to be here. My role is as the executive director of the Cell and Gene Therapy Center at Iqvia, as well as to head our life cycle strategy globally here at Iqvia. And Iqvia, for those of you who don't know us, is a over 86,000 person organization formed from the merger of two world-class companies, IMS Health and Quintiles. So our focus being on accelerating innovation and clinical development using our domain expertise, data, and analytics. I think this is such a great topic because at IQVIA, we're very closely engaged with all of our academia and early stage biotechs very early in the process. Because unlike many other biologics and other industries, it's so key to think about the whole product life cycle early in development here in our industry, whether it's CMC, manufacturing, regulatory, understanding that pathway, but also understanding the commercial viability of your therapies. Because as we see more of these approved products, it's so important for us to make sure these get to patients everywhere, to have that uptake that we're all longing to see. And so I think, putting the industry close to the academia is key to solving a lot of this so that we can think through these very early in the process and how industry can help inform these strategies and reduce the timeline to get to the patients. We've seen many examples of this in our industry, whether it's clinical strategy and operations like we do, and preclinical and regulatory support like we do, or we've seen a lot of these CDMO partnerships happening with academia. This is really key to bridging that gap. And I think the more we can come together as an industry to solve for this, the faster we'll see these therapies get to patients. I've been in this industry now for over 20 years, and I think my biggest really takeaway is there's no industry more collaborative than this industry. There's no one who needs to innovate more. It's sort of like building the plane when you fly it. So there's no way each of us can solve all of these problems in the industry. So I think it's really key to understand how we can partner to add value to each other, and how we can really again get these to patients as this industry has grown and matured, and we've done great with advancing the science. We're now dealing with all of the manufacturing challenges, and in order for us to deal with the access and patient access, it's really key for every stakeholder in the ecosystem to come together, because it's not just the industry or academia, but at this point we also need the payers, the regulators, the healthcare systems to come together to help us deliver on the promise of this industry. Well, I've been at this conference now maybe close to 9 years or so. As a regular attendee, this never fails to impress me. It's some of the best gathering of folks. I've really enjoyed connecting with colleagues, old and new, partnering to solve these challenges that our industry face. I haven't sadly had too much time to attend content at the meeting itself, but it looks great and I look forward to catching up. But I think, as always, this has been a great meeting.